Good morning. My name is Brian Cremin, and I'm a director of OvaCare, and I'm also your MC or chair for today's event. So I suppose firstly, on behalf of all of us in OvaCare, we'd like to very warmly welcome all of you here today. This is our third year holding patient days, and we now see these patient days as an integral part of the programme of support that we want to provide for you. And again, we're delighted to be back here in this particular location again for our third time here in Cork. So you're all very welcome. Just some housekeeping. Lunch will be at 12 until 1. And if any of you have any dietary requirements, please let us know and we'll cater for those. Mobile phones on the silent or the off position, if we could, please. And also the toilets are on the left hand side just beyond reception out here if you need to, and exits are very clearly marked. I'm going to do my air hostess a bit now. They're very clearly marked. They're here and they're here and they're there. So in the event of fire, I think the best one is the one up here. You'll all have received some your welcome pack when you came in. So and also what we'd ask you to do, and I'm looking around, you've it all done, is the name badge, name up there, and be proud to wear your name. It's very good for us in terms of us all meeting each other later, is to be able to connect and be able to use each other's names and so on. What we try to do is, while we're going to have an element of formality in terms of speakers and presenters and so on, we like to keep it as informal as possible as well. And the goal for today is for you to get as much as you possibly can out of today. It's not our day, it's your day. So it's your time to mingle, it's your time to talk to each other, it's your time to ask any questions that you really, really want to try to get answers to. Hopefully we'll have those today. You can ask your questions by way of, if you'd prefer, write out your question on a piece of paper, put it into the question box down there. We'll gather the questions, we'll ask those of the speakers. And then there's also the open forum to ask questions, which we'll have just before lunch. We'd have a mini question and answer session. We'd have the main question and answer session at 2 o'clock today. And again, that's your chance to have the questions that you can put in the question box, or the questions you want to ask yourself and get them answered. And as well as that, at lunchtime, if as we're all mingling around, that's also an opportunity to have any questions that you want to get asked. So back to today. Today's programme is designed to cover the physical, emotional and lifestyle effects of ovarian cancer. And while we want to give you as much information as possible, we also want to make sure we don't give you information overload. Okay, so our speakers are they're going to cover their own area of expertise and so on, but they also are skilled and knowledgeable about dealing with people in the situation that we all find ourselves in. As we have a number of speakers to go through, what I would say to you, the important thing is that you're comfortable and relaxed, and that if we need to do anything to make the room more comfortable, please let us know and we'll do that during the event. For those of you that don't know about OvaCare, we were founded in 2011, and our mission is to improve the diagnosis and education of ovarian cancer within Ireland through sharing global research and best practice, and also to provide support and advocacy through our dedicated support network. The inspirational story behind OvaCare is that of our founder and chair, June Feeney. And we always start with June coming and saying a small few words to introduce, the day and to welcome everybody. But we also start with a patient story as well. And we've got Maureen Sneed here today. Sneed, my apologies. I went down to Maureen and asked her specifically, could you tell me how to pronounce her name? And I make a mess of it in the first attempt. So, but she did say to me that, she has been called lots of things so it's Maureen Sneed. My apologies, Maureen, right? And Maureen will tell her story as well this morning. So look, what I'd like to do at this stage is call on June to give a very brief intro to everybody. So June.
Good morning, everyone. As Brian said, I just wanted to officially welcome everybody this morning. A special welcome to anybody who's it's their first time coming to one of our patient days. As Brian mentioned, this is the third time we've had one of these days in Cork, and this is the third time we've used this hotel. So, I suppose we've just been very happy with the venue, and I hope you find it a good venue as well. Also special welcome to people who've been here a number of times, and I suppose just to give you a little bit of background of why OvaCare was set up in 2011. There was a small group of us who had been directly affected by ovarian cancer, including myself, and we would have found that there was very little support available in Ireland. You kind of had to go outside of Ireland to get any information, or what information was available was very little, and in particular just to meet I know I myself would have loved to have met somebody else who had ovarian cancer, and at that time it was very hard to meet anybody in the same situation. So the first patient day we had was in 2012, and we've kind of kept with this format because it seems to work very well, as well as kind of a get-together, meeting other people. There's such a need there for information, so we hope that the programme today will fill some of those gaps for you. Since the first patient day as well, we found that we have it annually in Cork, and now we also have an annual one in Dublin as well. In between that, people were kind of looking to meet up a bit more regularly, so we also now have coffee mornings every couple of months in the Clarion Hotel in Cork, and just recently there's one started in Dublin as well, and the idea would be to kind of get them going throughout the country, and so far it's actually women themselves setting them up and setting up the coffee mornings, and OvaCare will support that in any way that we can with funding it and advertising it. So if anyone's interested in getting one going, just to let us know. Also, the online community has been a great help to people, and if you're not members already, you just go onto our website and you can become a member of the online community, and basically it's just a forum where people can kind of put up their concerns and have other women address them and give them their feedback. So I suppose that's it for me. I just hope you enjoy the day, and I'd like to introduce and welcome up Maureen, who's going to share her story. She's certainly been an inspiration to me and to many of us who attend the coffee mornings in Cork. And I'll ask you to come up, so please, Maureen. Thank you.
In case you think there's a present for everybody, there's not. As Brian already said, my name is Maureen Sneyd. I was originally going to say something at the beginning, but I'm putting it to the end now, typical of me. I was originally diagnosed in late 2010 with a pelvic mass, and was following complaining of discomfort in my lower abdomen, difficulty peeing, and a bit of constipation. No sign of an elevated CA1 to 5 reading. Following various tests and scans, they found a pelvic mass, and they decided the only thing to do at that stage was to do a hysterectomy to see was there anything worrying there. No mention of cancer, so I wasn't worried about cancer. Got over the surgery and went back to the surgeon for my post-surgery review 3 days before Christmas, and it was the winter. We had cold and rain, snow and frost. I went in and everything was fine with the surgery, and he said, "And sit down, Maureen." And he said, "I have a bit of bad news for you." What? He said, "We found clear cell ovarian cancer in your right ovary." He could have knocked me over with a feather. I got an awful shock because I hadn't been expecting it, and I was on my own. I didn't even know what the pelvic mass had been. I forgot to ask him. It turned out it was an ovarian cyst. I stood outside his room in the snow on the Western Road after that bit of news, and I can tell you, I cursed Buzz Aaron, who I worked for. I cursed taxi drivers, the weather, God, myself, everybody who passed me, everything around me, the wall behind me, and eventually got home in a state of shock. It wasn't my best Christmas, I can assure you. The first week in January 2011, I met my medical oncologist, and as I was still stunned, I didn't even know what questions to ask. All of the information was provided to me, the leaflets, the booklets, as much time as I needed with both the medical oncologist and the liaison nurse to explain everything to me. But the old story, ignorance was bliss. I sailed through the chemotherapy except for one minor detail. I had the usual chemotherapy, which was carboplatin and Taxol every 3 weeks. And if I mention a word, Movicol, a lot of you ladies will know exactly what I mean about the side effect of constipation. I had no hair either, but that was a minor detail. I got a wig, and for once in my life, I looked as if I had a good hair day every day. Right? They told me my hair would grow back curly. It did, and grey. So we got over that after the usual 6 sessions, and in May 2011 I decided to retire and start the next phase of my life. I assumed the cancer was gone as it had been stage 1 and I was not at risk of any reoccurrence. I mustn't have listened to the medical oncologist's words though. I really mustn't, because the choice of words, I just left and thought that was it. 3 monthly review, no problem. I took up golf, don't ask, became involved in voluntary work with the Daffodil Centre in the Bonds through the Irish Cancer Society. My usual 3 monthly reviews followed and all seemed well, and in September 2012 my oncologist was so pleased, so was I can tell you, I was put in a 6 monthly review. So off to Scandinavia and Russia to celebrate 3 weeks later. By the end of the trip, which was lasting about 2 weeks, there was a lot of travel, and I noticed I was quite tired at the end of each day, but I put it down to my age and trying to do too much and fit too much into every day when we were there. I came home, continued to try and learn golf, but I noticed as the days were progressing, by the end of each day, I was bloated and I just wasn't comfortable, so I had trousers that I'd have one pair in the morning and one pair for going out, and I'd have a different size for the evening so that I was comfortable. I happened to mention it to my GP, and he, thanks be to God for him, he realised that the symptoms sounded somewhat the same as the first time I had complained, and just said, look, we'll do a few blood tests, and if there's anything there it'll show up. Give me a ring, he said, in 2 days, and I did. And the cancer was back. In the space of 2 months from having no sign of it to being back. So now my CA 125 reading was never particularly high, it was only 69.1, and I suppose if one thing came out of it for me is that not to depend too much on that reading as a sign. It's just one symptom of ovarian cancer. But anyway, 5 days later I was back in hospital and on the merry-go-round again. The bloating was caused by ascites or ascites, I'm never quite sure how to pronounce the word anyway, and it was from the tumours which in that small space of time of 2 months had spread into my abdomen, onto my liver and my spleen. But this time, however, because of the work I had been doing in the Daffodil Centre, and I was also aware of OvaCare, I was much more aware of options, treatments and the marked survival time for recurrence of ovarian cancer. Outwardly, I seemed to be coping. I was saying, if it was cured the last time, the treatment will work this time. And I realised that I had to take that attitude. Well, I did anyway, because I felt if I broke down, it was going to be a sign of weakness. And then the cancer had control of me, and I hadn't control of the cancer. Mind you, I still felt it shouldn't have happened to me. Did I do something wrong? Was I misdiagnosed? Was I going to die, and how soon? Who could I blame? Somebody must be to blame for this, and I hated the idea of not really being in control again of something. Anyway, as I was considered platinum sensitive after the break of 18 months, I was back on carboplatin Taxol, and this time with Avastin. Just a different dosage and infusion plan. Some of them were given weekly at the beginning, with the Avastin every 3 weeks. So into hospital every week, once a week, should I say. And after the usual 6 cycles of carboplatin and Taxol, there was such obvious signs of the shrinkage that they decided to keep me on Avastin. So here I am, 18 months later, remaining on the 3-week cycle of Avastin, with scans every 3 months, Again, my hair went. I went bald, and had to get another wig because I was gone grey. So I got a second wig, and I got a fun wig, which I'll explain to you afterwards. My hair did grow back. It didn't grow back blonde, long and straight as I thought, unfortunately, but I can but hope anyway. So onto Avastin only, and I thought, okay, I can manage this. I read the information leaflet. I didn't have the side effects of it when it was on carboplatin and Taxol, so I said, sail through this, right? Unfortunately, like any drug we take, over time the side effects started to kick in. My blood pressure started to rise. I had joint pains and stiffness, bleeding gums, reflux, but there was another drug to help all of that, and I took them. I had a little problem recently though, little health problem, where my blood pressure rose so fast one particular day. All the drugs happened to hit a point on the same day, and my face went numb in the space of a couple of minutes and all down my right hand side, and the only thing I could think of was the ad on television, FAST, I'm having a stroke. I like to do drama in a big way, so I rang my sister and couldn't speak, so they just came straight down. They're living near me in Bishopstown, took one look at me and drove me straight to hospital. At that stage it was starting to come through, and I think I realised, no, I'm not having a stroke, but I was upset at that stage, and they brought me in, and in fairness they did everything. I had brain scans, I had heart monitors, I had nerve conductive tests, I had blood pressure monitors. I was wired as if for surround sound. It was wonderful. But anyway, it turned out it wasn't a stroke, thanks be to God. But I'm saying it's amazing. The anagrams that are used for ovarian cancer, BEAT, if only that was as well known as FAST, how much more aware women would be of ovarian cancer and the symptoms that may surround it. Each of us react differently to a cancer diagnosis, both physically and emotionally. I was upbeat for most of the time, but I did hate having to ask for help because I've always been independent, and it was a struggle for me to do it. I was only too aware of the survival rates, and I did that dreaded thing. I started looking up the internet last autumn and began a downward spiral. I really thought that by reading ovarian cancer research papers it would help. So if you can picture me at night time now, my mood getting deeper, reading research reports in this hand and a dictionary in this hand, trying to understand it, convinced I was going to go into hospital and say to my oncologist, I found the cure, right? And the only thing it did for me was that it drove me deeper and deeper and into depression, and it allowed that big black dog sit on my shoulder. And thanks be to God for support from the likes of OvaCare, the Daffodil Centre, Ark House, because one counselling session was all it needed to make me realise what was wrong. The dog got kicked out, locked in the kennel, and that's the end of it. I have no intention of spending my time looking up stuff on the internet again unless somebody actually recommends a site. I'm going to leave that to the doctors. They can do all the reading and they can find the cures. So June had mentioned the OvaCare and the website that's on it and the online one. It's absolutely marvellous. Those who haven't gone onto it, you make up a name so nobody knows who you are. You don't put in personal comments. It's your own view. If you want to ask a question that you may not want to ask your doctor, or you're wondering how other women are coping, and it was the comments and the support from that was absolutely wonderful. Now, while I will read articles in papers and information on possible new drugs and treatments such as immunotherapy, the role of vaccines, possible new treatments, I even looked up at the comparison of the compound elements of parsley and Avastin, believe it or not, VEGF. I won't go down that road again. As I said, I'm going to leave that to the professionals. I know that the drugs that were prescribed to me and are prescribed to me may not be the same as given to other women, and what works for me may not work for other women. I'm also very much aware that new treatments and trials may not be the ones for me, but so be it. They will benefit someone else. All I can say to you as women on this journey like me, have faith in your consultant and medical team. Fight and argue with him or her, ask the questions, But if we lose the faith and trust in them, it is ourselves we hurt. My oncologist paid me to say that. Support one another as we all deal with cancer in different ways. Some women may find it hard to open up and talk about it, but remember, there's always an ear that listens in cancer support groups such as OvaCare, the Daffodil Centre and Ark House, and there's always somebody to hold your hand along that journey. To the medical and research staff who will be here later today, I fall into the classic case for getting ovarian cancer. I was postmenopausal, late 50s, no children, never on hormone treatment, but I'm still waiting to meet those women. Too many of the women that I have met over the past 3 years are young, in their 20s and 30s, may have children, and in most cases their ovarian cancer wasn't caused by genetics, so maybe the parameters for the classic case of ovarian cancer could be looked at. I take each section of life as a bonus. I still can't play golf, by the way. The side effects of Avastin can be horrible at times, and as it results in other health issues. But will I stay on that drug? And would I go down that road again? Yes, it keeps me alive. So I'll go back to the paragraph I was going to say at the beginning. I'm 61, single, retired, yippee, interested in needlework, reading, playing bridge, 45s, cribbage, swimming, walking, history, architecture, travel when possible, and by the way, I have recurrent ovarian cancer. It's only part of me, it's not all of me. Thank you for listening. And while I am only one, together we are stronger. We create the awareness and strength by being here for others. And if any of you are ever stuck for a fun week, hold on, I have to get it out. I have it.